April is Autism Awareness Month. Autism Awareness Day is April 2nd, honored throughout the world. In recognition of how important awareness of this condition is, I would like to share my own approach to treating children with autism. The incidence of autism is actually rising and is now found in about 1 in every 68 childbirths. Logically, it has become increasingly important to recognize this disorder and explore healthy approaches to treating it. Based on what I have observed about this condition, I strongly suspect that excess adrenaline plays an important role. Adrenaline, as a neurotransmitter in the brain, provides both intelligence as well as an enhancement of creativity. Autistic children can be very creative as well as extremely intelligent. Some of them have been known to memorize a phone book. Exceedingly high levels of adrenaline in the brain is the reason they find it difficult to communicate. They shrink away from any type of sensory input, including eye contact, in order to decrease the amount of stimulus to their already over-adrenalized brains. Excess adrenaline can certainly create sleeping problems in these children and contribute to temper tantrums, since it is the fight or flight hormone. The brain uses more sugar per weight than any other part of the body. However, the creative brain requires much more sugar than a normal brain because it is a lot more active. Because of this, the body continuously pours out adrenaline to raise sugar levels for the brain via a process called gluconeogenesis. Accordingly, my approach to treating these children is simply to lower adrenaline levels in the brain. In order to accomplish this, I recommend using a 5% transdermal progesterone cream to help control insulin and also at the same time block adrenaline, plus a diet that includes large amounts of low glycemic carbohydrates, especially green vegetables, in order to provide a steady supply of sugar for the brain. The other fuel the brain uses is ketone bodies, and the source of this is either coconut or MCT oil. Now, once adrenaline is lowered, the mind will stop racing. The lowering of adrenaline also prevents overstimulation from sensory input, allowing the children to communicate more effectively. In addition, I would recommend certain supplements, possibly including digestive enzymes to help with digesting the vegetables, vitamin D3, and a B vitamin supplement. Several of my patients who had autistic children followed this protocol and saw dramatic improvement. One of these mothers included the following brief note at the end of a letter. My son, Frank, age 15, has autism. He has been using progesterone since February. He has been less anxious and calmer. He is more outgoing in social situations. He has been voted Student of the Month for February and March. At school, he is participating more, and the teaching staff finds less prompting is necessary. Overall, lots of nice changes. Again, to emphasize the dramatic effect that the lowering of adrenaline levels can have on a child with autism, I have included the following from the mother of a 3-year-old child with autism who had been non-communicative prior to the treatment, which started on February 17, 2014. On February 20th, she stated, "Ian has been great. We're all really impressed with him. He has heaps more energy. His speech has improved a lot suddenly, and he has been falling asleep amazingly easily and staying asleep. It is 9 p.m. now. I am ready to pass out, and he is super happy and lively and drawing and playing. We have never seen him this bright." Then on 3/17, she stated, "Ian is doing amazingly on your 5% progesterone. He is really starting to talk. He is able to put more words together and really trying to communicate. His energy and focus is way better. We are super delighted with him and cannot believe the change. It is getting some attention in the alternative health circles that I frequent." And then 1 week later, on March 24th, she stated, "I am going to have to really study the subject now, as Ian is doing really well on your program. His energy is up, his speech is exploding, and he is acting so much more like a regular little boy. It is great. Even his GP is starting to get impressed. She is coming around and getting interested in this field."